the Centricity EMR I use several metrics to show the return on investment. I think the one that kind of stands out the most is the FD ratio. For family physicians, the normal ratio is 4.5 to 5 employees per provider. We run 2.67 or so. So if you extrapolate what a normal employee in my market costs with healthcare benefits and taxes and everything, you're looking at about $40,000 an employee. So if I'm the average practice, and now I'm not the average practice, which the Centricity EMR helped me become because of all the efficiencies it's gained in workflows. So I'm saving from 2.5 to 5 about $100,000 a year per doctor. Clearly, I may run a more efficient staff to begin with, so maybe it's not truly the 100, but I feel pretty good about it being about half that. So we always use the number of about $50,000 a year in employee costs that we save per provider. We have 3 providers right now. We added our 3rd provider with adding no staff, so that was a big efficiency. The other metric we use is some of our doctors used to use transcription and ran around $10,000 a year. That's out the door. We used to run $5,000 to $10,000 a year in this is for the practice in supply costs. That's down to $1,000 or something, 1 to 2. It's just paper for printing and things like that. And so those are the big metrics in terms of what we call annuity savings. Year after year after year, they come back. In terms of revenue generators, they kind of come in 2 categories. One is just the improvement in our coding. We feel more confident. We used the E&M coder at first. Now we don't use it anymore, but our 99214s, for example, doubled to the tune of about $25,000 per doctor per year. And then the other thing is we're able to do some, especially after we were on it for a year or 2, we're able to do a lot of quality reporting, looking at anybody that's on a statin drug, for example, for cholesterol that hadn't been in 9 months or a year, whatever metric you want to use. Also using the protocols, there's various ways within the product to query that, but to have those people come back, which is a win-win for them. They're getting the quality care they need as well as more revenue for us. So we've seen that as a positive. And then just all the workflows that used to be in the world of the paper charts where they would just stack up in your lunches and the end of the day when you would get all your work done. And now that that's all being done kind of real time or just in time in between patients and virtually from wherever you are, maybe even at home or in the hospital if you have wireless, we're able to see a couple more people a day than we used to just in general. The office visits themselves aren't any faster necessarily, but all the extraneous things that go outside of the exam room have allowed us to add a couple more, 1 to 2 patients a day, depending on the doctor. So all told, you add those up, and those are the major ones, and you subtract out some of the new expenses you have, because clearly there's new expenses when it comes to support. You have to, not only for the software support that's recurring, but just the IT costs of running your network, upgrading memory, virus, things like that, and year to year that can obviously fluctuate. But we think it's anywhere between $50,000 and $75,000 per doctor per year is what our return is year after year after year. So based on what we paid for it, our payback period was within 18 months.